Guys and ladies and gentlemen, welcome to Teaching Tuesday, where we discuss all things insurance. Y'all know Medicare, life insurance, health insurance, and retirement planning. And today, guys, we have a strong subject we're going to talk about. It's the hot topic of the country right now, which is Medicare, with so many baby boomers aging into the Medicare population, okay, or baby boomers aging into Medicare, okay. So listen, guys, it's important that every one of my watchers watch today's Teaching Tuesday seminar. And the reason why is because most of my viewers are between the ages of 32 and I'm going to say 70, right? If you're in that younger age range, 32 to 45, your parents are now aging into Medicare, right? Like it's their time to get all the Medicare mail, get all the phone calls, get all the attention about Medicare. So it's important that we as the children kind of understand the way the Medicare world works. But secondly, if you are in that age range of, I'm going to say 55, 60 and on up, you are probably getting a lot of information about Medicare and how it works and all that stuff. So that's what we're going to talk about today, guys. So if you all notice, I'm kind of talking fast for two reasons. The first reason is I'm drinking this drink. Don't taste that good, but whatever. And then the second one is that's the energy drink. And then secondly, y'all, we have a lot to cover about Medicare, so I don't want to waste a whole lot of time. So listen up. About 7 years ago, I met the best manager that I've ever had in my career. Okay. Her name was Sherry Bagwell. Sherry Bagwell is now a manager at Anthem. So to those of you on LinkedIn, go look her up. Her name is Sherry Bagwell, spelled with an Sherry Bagwell, Bagwell. She's a manager at Anthem, an amazing manager, very knowledgeable about Medicare. And luckily, she taught me a lot about Medicare. So to those of you that know me, I started my career in Medicare about 7 years ago. So I still get a lot of questions, a lot of people wanting to know different things about Medicare. So I've been getting some questions, so I figured I was going to come here and go live and talk to you all on Teaching Tuesday. Now, remember, y'all, this is a fully interactive platform, so you can ask questions, give me emojis, smiles, all that stuff, and I can respond, okay? But let's go ahead and jump right into it. Today, guys, I made a picture of it. If you can see it, this right here, guys, is a Medicare card. And usually you get this card for two reasons. Either you're aging into Medicare at 65, you would get it about 3 months before your birthday, or you have been disabled for 24 months, okay? Amongst ESRD, end-stage renal disease, that's another reason why you may have it. So there's not really necessarily an age range for Medicare recipients. I have some of my Medicare clients that's 25. I have other Medicare clients that's 75. It all depends. Some get it because of disability, others get it because of age. But ultimately, we all have or will probably receive our Medicare card. Okay. Now, if you notice on this card, guys, we have hospitalization and medical. And let's start with Medicare Part A. Okay. So, Medicare Part A is also known as hospital. Okay. It says hospital on your red, white, and blue card. Okay. That Medicare Part A, the Part A is usually given without an additional monthly premium. Okay, it's called the premium free enrollment. Okay, now to qualify for that, guys, you have to have worked 40 quarters, which equals 120 months. So you have to work 10 years to get the premium free Medicare Part A. So when you turn 65 and you've worked all these years, you usually qualify for Medicare Part A. That's why it's premium free, because you paid taxes over a period of time. Now, we're going to go through each part of Medicare, A, B, C. We'll cover C a little and D, okay? But ideally, Medicare Part A covers your hospitalization, which includes your inpatient hospital stay, your skilled nursing care facilities, your hospice care, your home health services. That's what's included in your Medicare Part A. Um, when we're looking at Medicare Part A, okay? Now, what I did not include in there is a lot of people have questions about home health care, right? So, home health care, let's get very clear. Home health care covers you to get medical treatment at home. You're getting health care, right? So, it's not a service where people are coming to sit with you and talk to you about, um, you know, entertaining you or making sure you don't walk out in the middle of the street. None of that is included in Medicare Part A. Okay, home health care is, so they'll come in, a nurse will come in, they'll administer medication, um, um, they'll make sure that you're taken care of medically, but anything other than that is not covered in Medicare. Okay, especially not Medicare Part A. All right, so also, a lot of people's under the impression that nursing home care is covered under Medicare Part A, and it is with very limited benefits. Okay, so when we look at nursing home stay, when it comes to Medicare, Medicare does not cover you to stay in a nursing home. Okay, it covers as long as you're improving in your health. Okay, so whenever we look at nursing home stays, we're looking at improving your health with the understanding that eventually you're going to leave. Okay, not just staying in the nursing home under long-term care. It's not covered under Medicare. Okay, especially not Medicare Part A. Okay, so we've covered Medicare Part A, guys. Medicare Part B, I said two, but I meant B. Medicare Part B on your card, guys, is going to say medical. Okay, now, this part of Medicare does cost. It costs for all Americans. The premium I've seen go up over the years, okay? And for 2022, the premium for Medicare Part B is $170.10. So, to those of you that are getting your Social Security check and you notice that it's about $170 less, that's the reason why, because you're paying for your Medicare Part B. Okay. Now, your Medicare Part B, I call docs and procs. Okay. Also known as medical. Sorry, y'all, this light is still acting up. But your medical is your docs and procs. So, your doctor visits, your health screenings, your lab tests, your flu shots, to go to the primary care doctor, to go to the specialist, all of that is covered under your Medicare Part B. Now, remember, y'all, Medicare Part B is $170 and you have to sign up. It's not an automatic thing like Medicare Part A. Okay. Medicare Part B, you have to contact them and say, hey, I need Medicare Part B. Now, if you are still working, let me tell y'all this, because a lot of people I notice are still working, right? I had a client on Saturday that I went and saw. She was 73, looked great, just a joy to talk to, tons of energy. She's a teacher, she's still working, okay? So in her case, she wouldn't need to go and apply for Medicare Part B because she still has her health benefits from her job, okay? So you're not required to enroll in Medicare Part B until you need it, okay? So Medicare Part A, you're going to get it at premium free when you turn 65. Medicare Part B, you need to apply for. But if you already have health coverage from your employer, you do not have to worry about that. Okay. So, sorry, y'all. So I'm trying to look here and see if there's anything else that we have going on about Medicare Part B. Okay. So we know Medicare Part A is going to cover your hospitalization. And then we know Medicare Part B is going to cover your medical, which I call docs and procs. Now, what we're missing, guys, what we're missing is the ability to go get your prescriptions at the pharmacy. So remember, Medicare Part A is going to cover me to stay at my hospital. Medicare Part B is going to cover my surgery, but now I'm out of the hospital and I need to go to the pharmacy. Medicare Part D, I'm going to say D for drugs, prescriptions, not recreational, but prescription medication is covered under Medicare Part D. Now, Medicare Part D, guys, is something that you have to go out and get yourself. It's not provided by the government. It's not something you can call Social Security and ask for them to enroll you in. Your Medicare Part D is usually done by private insurance carriers that you enroll with that pays for your prescription medications. Now, the cost of those plans vary. Some of them are $10 a month, others are $75 a month. It really all depends on the amount of medication and the type of medication you're taking. So, guys, every year we have Medicare open enrollment season. That season starts October 15th and it ends December 7th. When that time comes, guys, it's your opportunity to sit down with someone, look at your medications, look at your healthcare needs, and change whatever plans you have. You'll know when Medicare open enrollment season starts because you'll get inundated with mail, you'll get phone calls, you'll get emails. You will know when it's open enrollment for Medicare, okay? So when that happens, you can contact me or you can contact your broker and let them come out and put your medications in the system. And then the system will bounce back and tell you which medications are covered and which ones aren't and how much that plan is, okay? So remember, your Medicare Part D is not given to you by the government, okay? They make sure that you have your Medicare Part A, you have to apply for your Medicare Part B, and then your Medicare Part D is private insurance that you have to go out and find on your own, and the cost may vary. Now, I get a lot of questions about the cost of its entirety to have this medical program, right? So we know your Medicare Part A is $0. Right? You don't have to pay for it because we paid taxes over the last 10 years, right? That's when we look at the quarters, the 40 quarters, okay? But now we have the $170 Medicare Part B that we have to pay for. And then I just told you guys, you will have to go out and get your own prescription drug plan, which may be another $20, okay? So if you're in a situation, guys, where you're unable to afford that, if your Social Security check is $1,000 and you don't have the 170 plus the 20 for them to take out, there's programs based on your state that will assist you in paying those premiums. Okay. If you need those programs, you can contact me. You can contact Social Security Administration, and you should be able to contact 1-800-Medicare, and they can direct you to the resources that's available in your state, in your county, that will help you pay those monthly premiums. Okay. So, guys, I'm sorry I'm talking so fast. I just know that there's a lot to cover, and I got a ton of questions right here that's showing up. So, if you all have questions, feel free to write them in the chat. I can answer them, go over all that for you. Okay. Now, let me tell you all the advantages of. I know you all may have heard of your Medicare Part C. Okay. So let's talk about that. Medicare Part C it's a type of Medicare called Medicare Advantage, which kind of lumps all of your Part A, your Part B, and most of the time your Part D into one big major plan, similar to what you have on your job. Okay. And a lot of times it's very cost effective for people to join those Medicare Advantage plans because most of them include your dental, your vision, your hearing, rides to the doctor, gym memberships, all of those extra benefits that you will not get from original Medicare. Okay. So if you're needing that dental, the vision, the transportation, the gym, if you're needing all of those, a Medicare Advantage plan could be something great for you to look at. Okay. Now, there's pros and cons to each type of Medicare. So we have original Medicare, which is what I just discussed with you all about, Medicare Part A, Part B, and Part D, right? That's our original Medicare. And then on this side, we have our Medicare Advantage plans, which those plans are done through private insurance carriers. So we're looking at, just to name a few, Cigna, United Healthcare, Blue Cross Blue Shield, Aetna. There's tons of private insurance companies that offer Medicare Advantage plans. Okay. Now, here's the pros and cons. I'm going to talk about the pros and cons of each. Okay. The benefit of having your just traditional Medicare, your Part A, your Part B, and your Part D is that you're able to go to any doctor within the Medicare network. Okay. So any doctor that accepts Medicare, which is most doctors, you're able to go to without having a network without having to stay within a certain coverage area. That's the main benefit of having original Medicare. Okay. So you can travel anywhere in the US, you're covered. And you don't have a network of doctors. You don't need a referral to go to specialists. As long as you have your red, white, and blue Medicare card, you're good to go. Okay. Now, with that red, white, and blue Medicare card, there is some cost when it comes to going to the doctor. Thank you all for coming in and watching, Tyson. Glad you're here. So listen, if you go to the doctor with the original Medicare, or you have a hospital visit or an emergency room visit, your copay is going to be 20%. Medicare covers 80% of any medical service that you receive, and then you're responsible for the 20%. That sounds pretty low, but the main point that we want to look at is that 20% has no max out of pocket. So if you have $100,000 surgery, your copay is $20,000. And if you had to go back in the next year or the next month for a similar surgery, you're going to pay the 20%. Now, with the private insurance companies, usually there's a max out of pocket that caps you for the year. And so once you reach that max out of pocket, whether it be 5,000, 7,000, 8,000, you don't have to pay any more for medical service throughout the year. Now, here's the pros and cons of the Medicare Advantage plans, okay? Medicare Advantage plans, one of the pros is it's going to give you many of them, your dental, your vision, your hearing, and your gym membership, as well as your prescription drug plan. A lot of these plans, guys, are $0 monthly premiums. So you don't have to pay for it every month. Okay. It's just you pay your Part B premium, and it usually covers your Medicare Advantage plan costs too. Okay. But here's the cons. Some of the cons that we have is that there's a network of providers. Okay. So you have to go to the providers in that network, similar to many PPO plans on your job. Now, there are some Medicare Advantage plans that are PPO, and you can go to any doctor you want to go to, or EPO, exclusive provider organizations, where you can go to some doctors and there's higher copays when you go to others. But that's determined by your Medicare Advantage plan. So keep in mind, y'all, when we're looking at Medicare Advantage plans, it's an individual decision. What you want to do when you're looking at a Medicare Advantage plan is you want to look at your doctors, you want to look at your prescriptions, and you want to look at your out-of-pocket costs so that you can make the best decision when it comes to which Medicare Advantage plan is best for you. If you're just wanting to stay with original Medicare so that you can have the ability to come and go as you choose with a limited restraints, then that network of doctors and things like that is not a major issue, but it's something we do want to look at your prescriptions to make sure we choose the best prescription drug plan for you. Okay. So I'm going to jump to some questions. Remember, y'all, I knew this was a subject that would take a lot of time. So I'm kind of rushing through it more than I usually do. And I'm drinking this drink. But let's jump into some questions that I'm getting. Miss Mary asked, and Miss Mary, thank you for joining. She's always here, okay? Miss Mary asked, when is Medicare open enrollment season? Medicare open enrollment starts October 15th through December 7th of each year, okay? That's your opportunity to update your plan, change your plan, all of that stuff. If you are in that low-income subsidy range or that Medicaid range, or you move out of the coverage area, or you lose insurance from your employer or your husband's or spouse's insurance, you have what's called a special election period, and you can enroll into Medicare or change your Medicare plan year round. But October 15th through December 7th is usually the time that we're looking at, okay? All right, Miss Sylvia, couples Medicare plan. Okay, is there a couples Medicare plan? And the answer is no. So Medicare is based on your individual situation. So there's no husband and wife or family plan under Medicare. Okay, I have my Medicare plan. My spouse has her Medicare plan. They're not a family plan. We each have our own deductibles. We each have our own copays. Okay, that's a good question. Now, I know some people, maybe your spouse didn't work. Many times you can pull from their Social Security hours, those 40 hours, and still get Medicare. So if you're in a situation where you're a stay-at-home parent, stay-at-home mom, or just a wife that kind of stays at home, doesn't work, or a husband that does the same, you can use your husband's or your spouse's 40 quarters to qualify for Medicare too. Okay, good question. Mario. Glad to see you here, Mario. Cosmetic surgery. Okay, so guys, cosmetic surgery is not covered under Medicare. Whenever we're looking at Medicare, we're looking at medically necessary procedures, flu shots, things like that. If you're looking for a cosmetic procedure, you can't get it under Medicare, okay? Of course, you can get it on your own, but it's not going to be covered under Medicare. So, whenever a provider submits a claim to Medicare, they have to show that it was a medically necessary procedure or service that was provided. So, cosmetic surgery is not included in that. Shirley, I lost my Medicare card. So, Shirley lost her Medicare card. Okay. To get a new Medicare card, what I would suggest you do is call your Social Security office, or you can call Medicare and request it there. The number is 1-800 Medicare. I used to know it, but I don't want to even tell it because I could be wrong. But ultimately, it's 1-800 Medicare, Medicare. Or you can contact Social Security, and the Social Security number is 1-800-772-1213. If you need a new Social Security card, Shirley. And if you call me, Shirley, I was about to say I could request it for you, but it's probably easier for you to do it. Okay. All right. I've already covered this, y'all, but Miss Angel asked, what about if I'm still working? If you're still working, you do not have to apply for Medicare Part B. Remember, your Medicare Part A is going to probably be given to you when you turn 65 or 3 months before your birthday. If you're continuing to work or you have coverage under your spouse's insurance, you do not have to go in and request Part B or Part D. Okay. But now let's talk about Part D, because this is a subject I wanted to get to. I just don't want to run over time, and I know we don't have a whole lot of time. I just wanted to come on and discuss a few things. Medicare Part D. Listen, guys, a lot of people that I'm seeing, a lot of my clients have Medicare Part A because it's free, it's given to them at 65, and then they request Medicare Part B, and it starts, but they never follow up and get Part D. Right? Listen, guys, Medicare Part D is a requirement. Otherwise, you're going to be penalized once you have Medicare Part B. So if you get Medicare Part B, whether you're taking prescription medications or not, still go get you a prescription drug plan that's really low cost. Like, you can get them for $10 a month. And then that way, if you ever get sick, you have a prescription drug plan that you can fall back on that can pay your Medicare costs, your prescription drug costs. Now, let's say, for instance, you are just a rebel, right? You're a rebel and you do not want to get Medicare Part D. You want to save your $10 a month. And let's say, for instance, you go through that for the next 5 or 6 years where you just refuse to get Medicare Part D. When you finally get Medicare Part D, there is going to be a penalty, and that penalty is a lifetime penalty. It's 1% of every month that you go without your plan, that you go without a prescription drug plan. It can be very costly because it may only be $10 a month, but it's going to last for the rest of your life. Okay, so let's just be more proactive and go find those prescription drug plans. If you need a prescription drug plan, give me a call. I can get you a really low cost prescription drug plan, just to say that you have credible coverage to avoid that fee. Good question, Mario. Okay. All right. So again, I just wanted to come on and discuss a few things. Y'all know it's Teaching Tuesday. I'm here every Tuesday at 7 o'clock p.m. I know I kind of rushed through today because I don't want to stay on here for 30 and 45 minutes. This is too much to cover. But you all can contact me directly. My cell phone 469-563-0658. You can DM me, you can email me, you can find me all over social media, Instagram, Facebook, YouTube, all of that stuff. So I want to say thank you guys for participating. We had some great questions. The following is definitely growing. This light, y'all. The following is definitely growing, which that's what ultimately I was hoping for. So share this video, like this video. Again, if you know anybody that's aging into Medicare, this information is really important because Medicare can be very confusing to a lot of people. So hopefully this is going to give you a basic understanding of Medicare. And then when you call me, we can go through your personalized Medicare plan. Okay. So hey y'all, this is John Davis, Teaching Tuesday, every Tuesday right here at 7 o'clock p.m. If you all look above, you're going to see the registration link where I'll send out all the announcements about Teaching Tuesday a couple of days before and the day of. And I look forward to seeing you all next Tuesday where we're going to talk about something. I don't know what we're going to talk about next week, but it'll be a hot topic of next week. But the hot topic of today was Medicare 101 stuff that y'all need to know. So, hey guys, I'm signing off. I'll talk to y'all soon. Thank you for watching. Have a great night.